Today, I'm happy to introduce and bring on Monica Rincon here with us today to answer a few questions on fertility, fertility education, and a little bit more about fertility awareness. She is a Marquette Method instructor and fertility awareness educator with MyCatholicDoctor. So I'd like Monica to go ahead and introduce herself a little bit more.
Thank you, Samantha, for this opportunity. And so I am a health professional, and I have degrees in health science that allow me to teach fertility awareness method and the Marquette method. So my background is I'm a macrobiologist, and I teach macrobiology as well at a level college. So I've been in the natural family planning rounds for almost 18 years when I got married, and I decided to learn about natural family planning. So I started learning billings, and I really like it and say, no, I want to teach this. And later I learned about Creighton, and I really like it because I need it for achieving pregnancy. And after that, I have my 3 daughters, and I learn about Marquette Method during breastfeeding. And I say, I have to learn this. And sure enough, I really like it. And I say, I want to be instructor in Marquette Method. So I completed another master's in health science in order to be able to get into the training for Marquette Method, the University of Marquette.
That's amazing. It sounds like you have a wide range of knowledge and many years. You said 18 years of experience?
Yes, 18 years, beginning with billings.
That's amazing. And we're happy to have you here today and answer just a few questions that we have on fertility awareness. So I think this will be a really great use of everyone's time.
Thank you.
All right, so our very first question, just to get to know a little bit more about fertility education and fertility awareness. So when clients come to you, what answers are they seeking and what are they trying to figure out?
Well, I will say, like summarizing that my patients or clients, what they are looking is a fertility awareness method of natural family planning that allow them to identify the fertile and infertile phases. And mainly what we want them is that they learn to identify when the women ovulate. Why? Because now we consider in medicine that the 5th sign of health in any woman is if she can identify when she ovulates. So you need to ovulate to conceive, and you need to ovulate to determine when your fertile window ends if you are using a natural family planning for postponing. As well, if you have any irregularity, any pain, anything that is related with your menstrual cycles. So we help women to identify and advocate, or doctor ask us to teach them a specific fertility awareness-based method to learn what exactly is happening with their menstrual cycles.
Okay. So you talked a little bit about natural family planning, fertility awareness. So can you kind of explain the difference between the two of those?
Okay, fertility awareness is kind of the core, like in our bodies, that move everything. So fertility awareness is known as a modern evidence-based method that women use it to chart their menstrual cycle. So they identify some biomarkers that help them to know when they are fertile or infertile. When we're talking natural family planning is based on fertility awareness. So in natural family planning, we have methods that are based on science, evidence, and they have instructions specific to postpone or achieve pregnancy. So we say natural family planning is more for the couple, and the fertility awareness is kind of a broad concept that women can learn just to monitor their reproductive health.
So natural family planning is more for couples who are trying to conceive.
Yes.
And fertility awareness is for just anyone who is trying to understand their menstrual cycles and kind of understand that aspect of it.
Yes, natural family planning as well is for couples that want to postpone pregnancy
Okay.
in a natural way, and they want to safeguard their fertility because fertility is a gift. So using natural family planning, fertility awareness methods of natural family planning, you safeguard your fertility as a gift. You're not trying to just trying to understand and use those signs and change your behavior if you want to achieve or postpone a pregnancy in that specific menstrual cycle that you're current, that you are in.
And that's so beautiful you bring that up. You know, our fertility is such a gift. So I'm glad you brought that up and made sure to recognize that.
Yes,
So while natural family planning is available for couples, kind of like you said, what type of fertility education is maybe available for teens and teenagers who might be interested in that?
Yes, so I would like to share a slide with you, but we have the program is called Teen Start. We was founded by Dr. Hannah Klaus, called Sister Miriam Paul. She's one of member of a sister of the Medical Mission Sisters, and she taught for many, many years Billings ovulation, but she knew that we have to prevent, or we have to get ahead before the couple needs to learn or the woman needs to learn. So it just in order that she created this program. It has been around for 25 years and is around like the same 25 countries, and we have it in the United States and in Canada as well. And what we want to teach with them is that these young people or young adults, they come to terms with their emerging sexuality and fertility and assist them in making responsible decisions. We always teach them in a holistic way so they can integrate the most important thing that is happening, that is the physical change, but they can integrate it into an intellectual, emotional, social, and spiritual develop of the person. And they can mature into an integrated, fully human being who are loved and are being created to be loved. So they know how to establish relationships and long-lasting relationships or friendships. So it's important for them that they need to safeguard as well this gift that they have or they are developing.
Absolutely. And did you have a slide that you wanted to
Yes,
share with us? Okay,
sure.
perfect.
Just a second. I just need to open here. And so this is the website to look. So it's called Teen Start. It's teenstar.org, and it's sexuality teaching in the context of adult responsibility. The director is Deacon Santi Molina, who is been in Billings Ovulation teaching for more than 20 years or more. And he is the director and has many, many experience teaching this. So there's courses for parents with their, always there's a parental guide and as well a consent. And they have it for middle school, high school, and in college.
Wow, that's amazing to have this resource available.
Yes, it is open to schools and parishes and parents that want their kids to learn.
That's wonderful. And so when, teenagers and young adult women, they are trying to start, charting their cycle to figure out, what's healthy, what's normal. So what do you do when you see something that is maybe not normal in a woman's chart? Is anything other than a 28 or 30-day cycle considered irregular? I know we've heard that a lot before.
Yeah, so we think that we have something that, or we heard that we need to have 28 to 30 days length menstrual cycle, but this is what we want to kind of make awareness as well, that what a woman needs to pinpoint is when they ovulate. So I would like as well to share a couple of slides that can help us to understand.
Yeah, absolutely. Because,
Thank you.
that's what I always heard, a 28 to 30-day cycle, that's where you're supposed to be at. And anything other than that, you're irregular, and it needs to be addressed. So this is very interesting.
Yes, so I'm going to first to explain really what we teach. So one is a woman can monitor by charting their menstrual cycle. So a menstrual cycle starts to have different events. So as soon as menstruation occurs, is going to happen the first event. The first event is that the brain will send a hormone called follicle stimulating hormone. And that hormone is going to go to your ovaries and is going to make you ripe or develop some of your frozen egg in your ovaries. And those frozen eggs are going to start producing estrogen. That is the second event. And that second event make a change. Is kind of a biomarker. So there's a change in sensation and feeling in the vulva of the woman, and that event here is preparing your body for doing the most important thing, the most important event, that is ovulation, that is releasing an egg from your the follicle that it was maturating. So that egg is released, and previous to that, there's another hormone that it has to come. That is the luteinizing hormone. That is the third event. Is going to kind of predict that ovulation is going to come. There's another biomarker, so we can use urine to detect this hormone. And we have the fourth event, that is in the moment that the egg is released before, but just make it in easy, you're going to produce progesterone. That is another hormone, and that rise your temperature. That is another biomarker. We can use temperature, or we can test progesterone in the urine, or your doctor will send you progesterone. So what it is very, very important to know is that when ovulation occurs, the phase after ovulation is called luteal phase. That is the production of progesterone. Is around 11 to 17 days after ovulation. So that phase is always regular. What is irregular, answering your question, is the previous is the follicular phase. So is the phase to prepare at the most important event, that is ovulation. So it could be long or short. And that is what it makes cycles long or short. So when we want these 28, 30, is that probably ovulation is going to occur just half in the menstrual cycle. But it could happen in short cycles. But the most important is that we identify when is the most probable day of ovulation. And it would be the same for longer, like 35. So there's some papers or research some doctors consider should be between 24 to 36 days, or some could be as well 22 to 42 days. So the length, it doesn't mean unless it's 3 months without menstruation, but the length is it is not the most important indicator or event in a menstrual cycle. Is that the woman can pinpoint ovulation. And that's what we teach. And we, in all the methods of natural family planning, fertility awareness method of natural family planning, we teach women to do.
And that's something I had never heard before. You just grow up thinking that it's a 28 to 30-day cycle, but it's almost reassuring to know that if there are women out there with, slightly longer or slightly shorter cycles, it's still within the normal range if they know that they're ovulating.
Yes, correct. And that's what now doctors are asking women when they come for their exam, your physical exam, or 1 year exam, is, do you know if you're ovulating? So that is an important question for women in their reproductive health, obviously.
Yeah, absolutely.
From puberty to menopause. Yeah.
So when trying to track your ovulation, what are the differences between the different methods of NFP or natural family planning?
Okay, let me look for the slide that I want to show. So just a second. I'm sorry.
Because I know there are many
Yes.
different types of
Yes,
charting that you can choose to do.
Yes, so I'm having a little trouble here with moving. Yes, it doesn't let me. Sorry, I'm having problems here getting the the presentation in a way that allows me to move. Yes, now. Okay, good. Sorry. So you were asking me about the different methods, isn't it?
Yeah, so it just kind of explain the differences between the different
Yes.
methods of NFP.
Yes. So I'm going,
I know
okay, perfect.
there's so
Yes,
many different
yes,
methods, there's apps out there, just
yes.
kind of to
Okay.
give us a better understanding.
Okay. So again, I'm going to share here. So first we need to know what are the signs in a menstrual cycle that can be used for a natural family method. Natural family methods are based on science evidence. So these natural family planning methods that we know, they have a specific instructions to be effective to postpone or achieve pregnancy, but they are based on signs and symptoms that women can use during these methods. So for example, when we can use a sign that is the cervical fluid. So women will use the sensation or the visual observation, and they are the what we call cervical fluid methods. So we have Billings ovulation method, we have Creighton model fertility care system, we have the 2-day method. In MyCatholicDoctor, we have certified instructor of each of these methods. Again, so if you use the temperature plus the cervical mucus, we have what we call the symptothermal methods. Symptoms because they're using the cervical fluids as a symptom and the temperature to confirm ovulation. We have as well methods that use urinary metabolites. So they are what we call symptohormonal methods. So they are using cervical fluid, they can use temperature, but they use the urine to test the hormones that the women are producing. So we have, for example, FEM, fertility, education, medical manage as well. We have doctors in MyCatholicDoctor that they use FEM because they are practicing restorative reproduction, and they use cervical mucus and they use LH strip to test it the day that they are approaching ovulation, the women. And we have the Marquette Method, that is one that I teach that we use as well. A clear blue monitor that allow women to detect the estrogen, that is the follicular phase before ovulation, and detect when LH is produced. And we can use another things like strips for progesterone to confirm ovulation instead of the BVT, or additionally to the body basal temperature. So this is a resume of the natural family methods that we can use.
So is there, one method that's better than the other, or, kind of what would you recommend?
No, there's not a better or a worse method. I think it depends of the needs of the couple, and it depends of what the women feel more comfortable using as a biomarkers. All these biomarkers are based on science, so they work. And I think it depends. For example, in Marquette Method, we have a specific protocol for breastfeeding moms. So because instead of using another symptom like cervical mucus, for some women is easy to use a monitor, but all of them, if you see with these doctors that are in MyCatholic, they have years of experience as well using it, not only as a natural family planning to postpone or achieve pregnancy, but to restore their reproductive health. And that's what it is. It is very important that women know about this, and couples.
And kind of to lead off of that, so how can, natural family planning restore your fertility? We hear that a lot, between natural technology. How can that help restore a woman's fertility if she needs that extra help?
Because the protocols that they have, they look at all the points that are necessary. Only so they look at the hormonal level, the endocrine level. That is what we do. We can see in the menstrual cycle how long is the luteal phase. For example, Creighton Method, they have many different codes to determine really how the cervical mucus is an indication of the amount of estrogen they are producing. As well, they could be another things that are physically affecting the organs that it can be seen by laparoscopy. And so doctors are trained to do that. So for example, in my case, I needed to use, I met personally Dr. Hilgers in California, and he helped me. So I really have a very nice chart for postponing, but when I needed achieving pregnancy, I was lacking progesterone. And with the testing, blood testing with progesterone, he determined exactly the amount that I needed. And that was my first child. And later after that, thanks God, I was healed. I was restored.
What a blessing. And you would have never figured that out if you weren't charting your cycles to have a healthy pregnancy.
Yes, so that's one of the thing, and there's so many papers that especially there's one published by Dr. Hughes and colleagues that show that they prove that some of the event couples that went into assisted reproductive medicine, when they come back, they were 72% of those couples were able to achieve with Creighton Method in almost completed the 6 months of training. So that is very important. And as well, there's another paper published in Marquette Method that they use of monitors to detect hormones in urine. 26% of the couples got pregnant in the second cycle, menstrual cycle, and 36% in the third menstrual cycle. So using those biomarkers, hormonal or cervical mucus or another temperature, or correcting them, they can get pregnant faster as well.
That's amazing. And even those statistics, what a gift to those couples that were able to conceive.
Yes, so it's a blessing. Yeah.
So you've given us a really great overview, of fertility awareness, natural family planning. So what would be your last takeaway from all of this?
I will say that the most important is that monitor your reproductive health is an asset for your health, because it can tell you your overall well-being. And not only because you want to postpone or achieve a pregnancy, you want to use it a natural method, is because you're safeguarding your reproductive health. And for doctors that know about natural family planning or use this natural family planning to treat and restore their health, it is a map, a road for them to know how their reproductive and some endocrinologically these women are doing. So it is important, it's very important to know, to have the chance to learn this.
Yes, and from everything you've said, starting out young and learning how to chart your cycle and just being more aware of your body, that's where it all starts. So it can help you the rest of your life.
Exactly, because it's a continuum. So you will know and you will accept even the changes that occur in perimenopause, that women have longer cycles, shorter cycles, until there's the absence of menstruation. That is menopause. Yeah.
And it's never too late to start, doing natural family planning or anything like that. Is that correct?
Yes, it's never, because doctors and women can have an awareness of really what is happening instead of guessing what it is. They know, okay, now I'm changing, my body is changing, I'm getting older, and I can see it in my charts. And even if they notice something like an infection or something, they know this is not normal. This is not what I normally observe. So that it was another way to advocate for their own health, being just monitoring their health with their charting their menstrual cycles.
Absolutely. And it's so important to be an advocate for our own health.
Yes,
Well, thank you, Monica, for going over all these different questions we had today and providing greater explanations. This will be really helpful as we go forward. Did you have anything else to add or questions you wanted to clarify?
No, I think I tried to do the presentation as very, concise and simple so everybody can understand, especially all the women and couples that are seeing us.